Hi, welcome to Health Hub. Today we're going to shine a spotlight on vitamin D, the sunshine vitamin. So with almost one in four Australians diagnosed with a vitamin D deficiency, I guess it's an important one for us to keep track of. So what is vitamin D? It is a hormone that controls the levels of calcium in our blood. And it also has a really big role in keeping our bones strong and our muscles strong as well. And there are some other important factors around why we need to keep our vitamin D levels up. Bonnie's going to have a bit of a chat about that.
Yeah, so thanks, Sam. Apart from reducing the well-known research on reducing your risk of having a fall with its links with muscle function, basically vitamin D sets off a cascade of enzymatic reactions in your body to help support the system. So there are a couple of other links as well. So vitamin D has a link, the deficiency has a link to reducing, a link with chronic lower back pain and also chronic pain as well. It also reduces your risk of developing acute upper respiratory tract infections too. It fights disease, so there's links to heart disease, multiple sclerosis as well. And it has a function and role in wound healing. So vitamin D plays a crucial role in controlling inflammation and regulating an infection as well. Vitamin D is also there's been a bit of research in regards to being a necessary nutrient for having a healthy mind. What's the research around that, Sam?
That's right, yep. So there's been a fair amount of research around a link between vitamin D and depression, but researchers aren't really sure what that relationship is. They know there is a relationship, but whether it is that having a low level of vitamin D can lead to depression, or it's the other way around, and when you have depression you're not out and about as much in the sunshine, you're not taking as much nutrients, and therefore that leads to a depression. So still a bit of work that needs to be done in that area. Yep. But you, Bonnie, and our colleague Alison, you have conducted some research a few years ago here at St Vincent's Private Hospital. Can you tell us a bit about what you found?
Yeah, so our research that we did was basically identifying those who are receiving nutrition support in the hospital over 1 year, and identifying those if they were at risk of vitamin D deficiency. So we found that almost up to 400 of those patients, that when at least 30% of those were at risk of vitamin D deficiency, and when we tested them, over 90%, so almost all of them that have been tested were deficient in vitamin D. So those levels are quite similar to the Australian health levels as well of deficiency in Australia.
They sure are.
Yeah.
And what might some of the risk factors then be for people to watch out for in terms of the vitamin D deficiency?
Yeah, so some of the risk factors for vitamin D deficiency are, if your ethnicity, so if your skin colour, if it's really dark, you might be less likely to absorb vitamin D. Mm-hmm. Also perhaps if, you need to wear modest dress, for example, religion or anything, and you just need to cover up your whole body. Also just having low sun exposure, so say if you're an indoor worker, or if you're a shift worker or anything like that, or just basically an office worker and being indoors all the time. Season also plays a role as well, so you're more at risk in winter, and there's less sunlight, and less risk in summer as well. Also the frail elderly are also at risk, maybe that could be housebound or indoors and not moving around as much perhaps, and also those living in a larger body, and as well as certain disease states, so think malabsorption syndromes or irritable bowel disease or anything like that. That's just some of the risk factors there, but where exactly do we get our vitamin D from, Sam?
That's a good question. So you can get small amounts from food, obviously, and we've got some examples of some of the foods that contain vitamin D here. So eggs are a really good one. We have some dairy food, so some milk and some cereal and margarine that are often fortified with vitamin D. And also a really good source is our fatty fish, so fatty oily type fish, so salmon and tuna and mackerel are good examples of those. There's a little bit in small amounts in beef and liver as well. So they're kind of the main sources of vitamin D in food. But food overall only makes quite a small contribution to our adequate amounts in our body. It's difficult to get enough just with food. And actually, primarily, its absorption through the skin is how we obtain enough vitamin D.
Oh, okay. So how much sunlight then do we need?
Good question. So this, as you mentioned before, this changes depending on the season. It's been shown that in summer, the Australian population levels of deficiency are around 14%, but in winter that more than doubles. So we have to take that into account when we give advice around how much sunshine we need, and I guess we also need to consider and balance that with sun safety. So what we take advice from the Cancer Council, and their advice is when UV levels are 3 or above, that you only require small amounts outside. So the example that they've given actually is if you just walk outside and get your lunch when you're at work, those few minutes out in the sun with your skin exposed is enough. And when UV levels are above 3, of course, you should definitely be wearing sunscreen. When UV levels are less than 3, then you have a bit more time outside, and you can go out sort of during the middle of the day, maybe do some gardening, go for a brisk walk, and your skin being exposed for longer periods of time. So I guess it's really important nutrient to consider moving into winter when there is that higher risk of deficiency, and also considering that we've all been in lockdown the last few months, so we've all not been getting out and about as much as we normally would have. So it's a good time to maybe have a chat with your doctor about whether they think you should get a test to check what your levels are like.
That's great. That's very interesting. Thanks, Sam. So thanks for joining us today for Health Hub. If you've got any questions, just leave some comments in the box below, and then we'll get back to you when we can.